Hi, everyone, and welcome to the next episode of Welln'ish. Today we have a very special guest. Her name is Marie-Josée Lord. She's a pelvic floor physiotherapist here in Montreal. I first heard about her magic touch through several of my patients. I remember it was in 1 month, your name just kept coming up over and over again, and I was like, I need to get in touch with this woman. She sounds amazing. I became fascinated by you immediately. I really do believe that you're a pioneer in the, manual therapy approach to women's health. And I thank you for that because I feel like right now women's health is really like a sexy topic and there's more conversations happening surrounding it now. Whereas I feel like, when you started, it must not have been the same environment. So I think it's pretty awesome. For those of you who don't know, Marie-Josée founded the first, and to my knowledge, all-female run pelvic floor or pelvic health clinic here in the West Island of Montreal. She has a team of pelvic floor physiotherapists, osteos, lactation consultants, pediatric therapists, acupuncturists, naturopaths, and even red art therapy. She has an entire team dedicated to improving women's health, and she has definitely smashed several glass ceilings so that the pelvic health of our community could best be served. So, welcome.
Thank you so much for having me. It's a pleasure.
I'm really excited. So, the first question I wanted to start with, and I get this question all the time, is what exactly is a pelvic floor physiotherapist?
All right. Well, that's the question we get all the time. A pelvic floor physiotherapist is a physiotherapist that has done special training into more of the muscles of the pelvic floor. So the physiotherapists are trained to do more internal techniques, either vaginal palpation or anal palpation, to be able to get to those muscles. Now, we have to understand that these muscles are all internal, so we can't really see them. We can't palpate them unless we do an internal technique. But I can tell you that the field of pelvic health has changed a lot because it used to be that we would look at pelvic floor muscles, but now it's the whole pelvic abdominal cavity. So there's a lot more treated by pelvic health physiotherapists now than when I started 30 years ago.
Amazing. So what kind of things do you guys treat? What a lot of women were asking me, why should I go see a pelvic floor therapist? Like, what are some cues or some signs and symptoms why I should make an appointment, why I should go see one?
Yes. So it's a very broad field. So it first started that we were treating mostly people that had urinary incontinence. So leakage with, let's say, coughing, sneezing, doing exercises, like jumping, especially after having a baby or at menopause. And then we started to treat and see more dysfunction into the pelvic floor. So we're treating a lot of women with pain with intercourse, women that have just what we call a persistent pelvic pain. It could be from many reasons. It could be due to maybe bladder, maybe due to some endometriosis. It could be spasms of the muscles of the pelvic floor. We also treat what's called the diastasis recti, which is the separation of the abdominals that happen during pregnancy and how to re-educate it afterwards. So this is what I meant by now we're looking at the whole abdominal cavity. Constipation, any type of anorectal dysfunction. So there's constipation or problems with holding stool, like let's say urgencies. There could be a lot of birth traumas that will lead to problems with, yes, holding urine, but also having some problems holding gas, holding stool. So these are all things that we will see. We do treat men as well, and we do treat children as well. But if we keep it to women's health, there's the whole, I think the whole aspect of core as well, So maybe people don't know, but when they're trying to do core exercises, because it's the in thing to do right now, it starts from the pelvic floor muscles. You can't do core exercises unless you properly contract and relax your pelvic floor muscles. So a lot of people try to do their core exercises. It's not really working. They have back pain, and it comes from a lack of understanding of how to manage these muscles, either contract them or relax them, because we can have as much dysfunction from a muscle that is weak as a muscle that is too tight. So
I remember being shocked when I went to a session with you and it was like, okay, now relax. Nope, relax the muscle, like just and I feel like I'm somebody who's very body aware, and I couldn't believe that I had zero concept of like how to relax my pelvic floor. Right. I feel like I only now understand it after like several sessions, but I mean, I just find it so funny how we know so little about the muscles in our pelvic floor.
Well, you know that there's actually a study that was done, I think it's 2014, to show that if you are given exercises, let's say I give you a sheet of exercise of Kegel exercises, right? Because that's the common name for pelvic floor exercises is the Kegels. Right. So people, when they were given just written instruction or verbal instruction, 40% had no idea how to do them, and they were doing them incorrectly. It's not as easy as we think. We may think we're doing it properly, but like you said, we may not relax properly. We may not contract. Yeah. So it's not that easy.
I have a lot of women who obviously, I always try to like warn women, because I've had some people who were shocked. They didn't know that, pelvic floor physio does internal techniques. So I was just wondering if you could kind of explain like what the importance is of doing and I'm actually going to just grab my pelvis here, what the importance is of doing an exam like anally or intravaginally. Yep. Why do we?
I have my pelvis here, so I could show it on. I can show it
perfect.
On my
pelvis.
You got yours. Yeah. So what happens is the pelvic floor muscles are the muscles that are at the base of the pelvis, right? So if we look at it this way, we have the urethra here and the opening of the vagina and the anus back here. So all of these are pelvic floor muscles. And if I remove this, then we see that these are the big muscles that are internal. So when you're standing, you're like this, you can't even really see them. Yeah, your muscles are all inside at the base here. So this is why it's difficult to know if you're doing them properly. A lot of people tend to squeeze their buttocks because the buttocks would be way over the pelvic floor muscles here. You see how far they come up in the back? This is the bone of the sacrum, the bone in the back at the base of the spine. And all these muscles are pelvic floor muscles, but you've got the buttocks on top. So a lot of people tend to contract their buttocks instead of contracting their pelvic floor muscles. And a lot of people tend to contract their abdominal muscles that are here instead of their pelvic floor muscles. So
That's definitely what I was doing.
So what we do is we will do an internal exam. So I left the organs that are like the bladder, the uterus, and the rectum. I left them in right now. So we do an internal exam through the vagina to be able to reach these muscles. But listen, I know a lot of people say, "Oh my gosh, I wouldn't want to have that done. I don't think it's something." But it's like having a gynecological exam. But I would say, with more care, we take our time to do it. If the first time the person is not comfortable, well, there's a lot of external things we can do, and then build into trying to do an internal exam, because I really think it's the best way to learn and to actually feel where those muscles are. And I think that's when you realize that where the muscles were and how do I relax these muscles, because it's not always easy to do that. So by doing the internal exam, I'm going to take the organs out right now. So if we do an internal exam, we can definitely feel the muscles more and be able to tell the person, well, this is where you need to contract. And sometimes with a birth trauma, there might be one side that's not contracting as well as the other side. So we have to try to help the person to to feel or visualize in their brain where that muscle is. So the tactile sensation helps a lot. And I think that's why people don't know how to do their contractions, is because it's very difficult to reach those muscles. If you want to contract your bicep, you can feel it, you can squeeze and you can touch it, where these muscles, you can't. I mean, women can put their fingers in their vagina and see if they can feel the contraction. But if they have a muscle that's too tight, they're not going to feel the contraction, and they're not going to realize that their muscle is too tight.
Absolutely.
Yeah.
I also think there's another layer to that where it's like, you know, I know so many people who have never even like looked at their own vagina. Like it's like it's still like taboo. We still associate our pelvis with like negatively, I guess you could say. So I think like getting women to finally come and look and feel like the muscles and like the effect that they're having on their whole pelvis balance. Like this even goes beyond like the specific pelvic issues, but like even the nerves that pass right there. People who have had chronic back pain, coccyx, like even musculoskeletal. This is such an important area to address, but we tend to want to just like pretend it's not there.
Absolutely.
You're not comfortable talking about it.
Yeah, exactly. And like you said, it has an effect on the sacrum and on the coccyx. It has an effect higher up onto the sacroiliac joint. So people that have back pain, but also people that have hip pain. A lot of hip pain comes from the pelvic floor because there's a hip muscle here and the pelvic floor inserts on this muscle. You should see the number of times in the practice that I have to show women, like, what are the structures? Where is the clitoris, the hood of the clitoris, the labia? Yeah. These are all important structures to look at. You want to make sure that the labia minora are moving well, that there's no skin problems, even vulvar hygiene. It's unfortunate, but nobody talks to us about vulvar hygiene. And that's something that we should all know about. Like, we see a lot of women with irritation, and all it is, it's that they're not using the right products. They're washing the vulva with soap. We should not wash the vulva with soap.
That was something that I mean, I'm in this industry, and then when I went to my first session with you, I was like, oh my gosh, how have I never been told, like, washing damages the skin, you should be hydrating everything there. And people who deal with painful intercourse or anything like that, or previous trauma, it's like, we just think about like internal, but there's also all the external skin that can be having an effect with any sort of penetration, even women with difficulty putting a tampon in. It's like, Absolutely. I had never been told about exactly what you said, vulvar health.
Yeah.
It's interesting.
It's very lacking. It's unfortunate because it's so basic. And it's also, I think the other thing too is with the new trend of having people shave, there's more of a need to use better, like having better hygiene, because, and it doesn't mean cleaning more. Better hygiene means, like you said, not washing with soap, but using a cleanser instead, or just water. People have this idea that the area smells, but it doesn't. It's the more you use soap, the more the vaginal flora has to redo itself, and then that could cause some problems. But these are all things that we're not told, unfortunately.
So what would you say, like, just for somebody who's listening, some basic tips that every woman should start to apply in terms of hygiene?
Well, like I said, making sure that they're not using soap in the area. It's not an area that needs to be cleaned. Just water is fine, or a cleanser. Things that people use for acne on their face. I mean, if I had to mention some brands, like people know of Spectrogel, CeraVe, QT Base, all those cleanser. They don't do the same to the skin. And using just a non-scented cream, to like very neutral cream, to once in a while to hydrate the area, just like we do on our face, but we don't think of putting it there. And women that shave or had laser hair removal in that area will tend to have more dryness, especially if they wear like those panty liners that will cause more irritation. And sometimes they don't realize that this little irritation goes into a burning sensation, and it is just from being irritated.
Could probably prevent a lot of women thinking like they have something else too. You know, anytime you hear burning, itchy down there, it's like intense panic.
In infection, they think that they have an infection, or they have the, you know, like a yeast infection. Yeah.
Okay, interesting. The other thing I wanted to point out that I loved about your clinic is that, you know, for women, I've seen quite a few women who have had past trauma. So the idea, or even just have so much pain with anything being inserted. So like the gynecologist has become something that they really negatively associate. It feels very difficult. And what I love about your clinic, and this is for anyone thinking of going to a pelvic floor physio, you actually got custom chairs made to make the experience like more relaxing, more like a team effort, less just like lie on the table, spread open, like having your legs on these metal clamps. And it was really, I don't know, I just thought you set that up so well.
Yeah, well, thank you. I did work hard to have these tables made according to specifications that I wanted, to be able to have the person relax their knees and not, like you said, not feel that they're holding their feet. There's nothing worse than when we're the gynecologist and we have our feet in that metal stirrup. So just being able to have different position and make the person comfortable, because I think that is the most important during the treatment. Is the person has to feel comfortable, the person has to consent to what we're doing, and it is all about what, like, the experience of the person. It's not what we impose on them when they come to the clinic. I mean, we're trying to give them the tools to help get over whatever their problem is. But we do realize that it is, like you said at the beginning, a bit of a taboo area. It's very personal. So that has to be respected too. And that's important. I think feeling comfortable with the person is the most important thing.
Yeah, how could you ever relax your pelvic floor and have someone palpate it and being comfortable? I felt so comfortable. I mean, I'm fascinated by this. I remember you're like, do you want to see? I'm like, yes, I want to see. This is so cool. And I know everyone's not like that, but it's like when the person is part of the process, and it's not just like your head's at the other side and, you know, just try to pretend I'm not doing what I'm doing and like this is going to be over in 5 minutes. It felt very collaborative and like learning about your body and making that area seem less scary. I thought that was really important. And I just appreciate how well you guys set that up. So another question I wanted to ask you was, so when you were in physio school, was there a women's health or a pelvic health section, or how did that look? And you talked a little bit about how it's evolved over the years, but I would love to hear a little bit more about that.
So yes, I graduated quite a long time ago, and it's funny because we did have a women's health course that was a preparation to delivery. So because apparently physios at that time would help to teach some of the prenatal classes. And we had a physio from Australia that was doing quite a bit of work, and she was teaching. And I remember, so we're talking like 1984 here, and she was teaching us. We were paired in two, and we would squeeze the other person's thigh so hard to cause pain of contractions. And then the person had to breathe through this pain, and we had to teach the person how to breathe. Really? Anyway, so that was the women's health course that we were doing in those days.
Oh my gosh, that's funny.
I felt that something else has to be done, really. And soon after I graduated, I decided to go into osteopathy to be able to do internal techniques. But because it was kind of at the end of because at that time osteopaths could do internal techniques, and I felt that it was too far into the course. So I continued my course, but I also decided to look into what was offered in physiotherapy as postgraduate courses. And
Okay.
we had some people that ended up coming from Belgium and teaching us. And soon after, I think we developed so many more techniques here that we made it go a little bit faster. And now I'll tell you that, which is really good, is into the physio programs, they really talk about pelvic health. And now there are some courses, they're talking about it for core stabilization, but they also offer some universities will offer the course so that they can start to do pelvic health. But of course, there's much more to do after they graduate.
Okay. So, for example, for the therapists who work at your clinic, what qualifications do they have?
So so obviously they're all physiotherapists, right? And then they have taken all the courses, the specialization courses that I would require them to have to be able to work at the clinic. And because I do a lot of teaching across Canada as well to physiotherapists, so that's good because I mentor them a lot. And I think that's what's important. And that's probably the most difficult for physiotherapists, is that they do have to hook up with someone with experience to get the mentoring, because you do get a lot of continuing education that's available. And I think all the physiotherapists are doing that. But it's a little bit at a time, right? And then after that is being mentored, having someone there to go over cases, to determine, okay, what should be done, there's a case that, what kind of approach should they do? So my physiotherapists here have done like many levels of training, and then I meet them regularly so that we go over cases. And this is the way I think that you end up learning, because it's hard to just be by yourself in a room and know what you're supposed to do.
And it's hard to, it's so important, especially in this domain, because it's uncomfortable to have somebody, shadowing you while you're treating someone, especially like a new patient or someone who's not comfortable. So that's great that you guys have found a way to talk about it and learn.
Yes, you're right. It is unfortunate a little bit, and I understand. It'd be so much easier if we could have somebody else in the room, but it's so private that sometimes that's not possible, or people have issues that they don't want to discuss with many people. So I think we have to respect that, and yes, we're trying to find other ways of managing that.
Right. So just to come back to a point that you said, so for those of you who don't know, I think it's physiotherapists and nurses, and obviously gynecologists, are the only healthcare practitioners who have the right to do any sort of internal exam. In osteo school, we have learned it. So technically I have tools, very basic, to do internal things, but I'm not protected. I don't have a specific right to do it. So it's a very gray area. And so most osteos avoid it. That's why I'm referring to your clinic. And I just wanted to ask you, for the therapists who are listening, is there a school or a specific post-grad course for any woman therapist who's looking to get into, I guess it would have to be a physiotherapist doing some sort of post-grad course? Is there a university in Montreal that you recommend, or online course, or?
So what there is, so you're right. Now, the physiotherapists that are allowed to do the internal have to have this special training. So it's not all physiotherapists that can do that. They definitely have the special training. Then this training can be done. There's different ways of doing it. There is University of Montreal offers what's called a kind of a micro programme, which is some courses to do this, but it's only in French. My colleague and I have been doing courses. It's been about 25 years now that we're teaching physiotherapists for this postgraduate courses, and it is more as people want to take them. Like they are offered regularly, and we do them across Canada. So these are courses that are also offered, and they're in French and in English. So these are the two, I would say, the two streams that are offered here in Quebec for.
Where can people find your course?
So the company is called Physio Eurosanté, and it's we have a website online. And the courses are across Canada. So because of the pandemic, we've adjusted and we still have our courses across Canada, but we've designed them a little bit differently to be able to have people in different centers and offer them. Yeah.
Okay. Amazing. I didn't even know that you did that on top of it.
Yes, I've been doing that for quite a few years and I think it's so important to properly train the physiotherapists because that's one of the reasons that I started my clinic. And I had been wanting to start the clinic for years, but it never I didn't have the right partners. It wasn't the right time. So finally I was able to have this multidisciplinary clinic. But it's also, I felt that I wanted to be able to train some physiotherapists to continue the work that I had started. I mean, I started this work on the West Island of Montreal like over 30 years ago. It was not easy because the doctors were not referring. They didn't really know about pelvic floor. They didn't really believe it because it was better for them to do surgery. So sending to physio was something that orthopedic surgeons would do, that family doctors would do, but not for pelvic health. Like, why would we send someone to physio for urinary incontinence? So it was not easy. It was trying to get the referrals, trying to build a practice, trying to build, like doing tons of conferences to doctors, into their, like urologists, gynecologists, which we still have to do. And attending a lot of international conferences to be able to build this. So I thought, okay, I can't just close the door one day and it just stops here. So I've been doing a lot of teaching and mentoring because of that. And that's why I wanted to have some physios that will be able to continue what I've started. And I think it's for me, it was really important.
Of course. Wow. I didn't know all of that. That's, I feel very grateful. Thank you. And I do think that Montreal is a place where we do talk about it a lot more than other places. And I think you definitely had a big hand in that. That's, I don't know. I think we're lucky.
Well, I think, so one of the things is, if you look at just with pain with intercourse, which is called dyspareunia, right? There was a huge team, which is not as well. It's still big, yes, in terms of research, but there was a big gynecological psychology team at McGill, and so much of the research into vestibulodynia was started from here, from Montreal, with Sophie Bergeron. There was Caroline Pucal, Elke Rising. So many people, and they included us into their psychology PhDs. They included us as physios to try to develop some of the techniques, try to see what our treatments were doing. And we were a huge center here. And now Sophie still does a lot of research at Université de Montréal. So Montreal is a big hub for pelvic health.
And yet I still find like I was talking to someone who lives in France, and every single woman there gets government funded pelvic floor physio at their birth. Did you know that?
Yes, I did, but it stopped in 2016.
Really?
Yeah, only the people. So before 2016, it was everybody would get about 10 sessions of physio, no matter what. Even if they had problems or no problems, it would either be pelvic floor, abdominal re-education. That's what they did. Now, in 2016, the government changed it, and now it's only the women that have problems, which you don't know you have a problem until you know. What I mean is, yes, you might know that you have leakage, But what about pain? You may think like that your pain is normal, but it isn't normal. You might find that, for example, you might find that you bend down to pick up your baby and you get pelvic pain. And you think, oh, okay, I just had a baby, but that's not normal. They're like even 3 months postpartum. So
exactly,
it should still, it's unfortunate that they took this program away. It was such a good, we used to reference that and say, oh, wow, this is where we want to go to. But,
that's what I wanted to ask you is like, what would your vision be for pelvic floor physio going forward, or women's health in general? Like, I love how you have set up this multidisciplinary clinic, but if you're thinking like no limits, what would that look like?
I really think, as much as my clinic is private, and I wish this would be available for women in the public system. It really is something that is needed. And unfortunately, there's only a few hospitals that have it, and for very specific clientele, and they have a long wait list. But this really should be available to women publicly, at least to have a few sessions. And then if they need more, then they could go into the private system. But it should be available to everybody. I really feel that that's what's lacking in our system.
And it would take pressure off the specialists, off the urologists, the gynecologists.
And we would be doing prevention, not trying to solve a problem, but we would prevent a lot of things. So if women, it's the same as having, let's say you have a ski accident and you hurt your knee, and then the person starts to walk on it and they don't go see anybody, but they're like walking on it, and then they start to compensate, and then they get some back pain, or they get some, pain somewhere else. And then a year later or a few months later, they're like, oh my gosh, it's still hurting. So now it's at the point where they need to go and have that worked on. Where if they had gone right after, it might have been easier because it would have prevented having more problems.
Absolutely.
And after birth, we have to think that there's been a stretching of the muscles, there's been stretching of the abdominal muscles. Things are not working the same way anymore. And women expect things to come back exactly the way they were before, and they won't. So they have to learn how to prevent and how to help things. So in a perfect world, I think, all women should be able to have at least some access to pelvic health, but unfortunately we're not there yet. And hopefully one day we will. And especially I was talking about postpartum, but what about pelvic pain? What about,
exactly.
There's so many issues, like just menopausal issues. A lot of women don't realize that they start to have some discomfort, and then they start to have pain with intercourse a little bit. Nobody has talked to them about the fact that, there could be vaginal atrophy. And, there's just like so many things that just start from a little thing that they don't know, and then cause some major problems. So that would be the thing. And I think, I just got into about 4 years ago, I just got into the field of breastfeeding as well. Because we do have breastfeeding here at the clinic, but I had started to treat, because this is not something that is very known to be done by physiotherapists, is engorgement and mastitis when women are breastfeeding. This is something that they do in Australia. They've been doing that for 30 years in Australia. So I started to get into this field, and the techniques are completely different than what is done from the lactation consultants. So that's even, I feel like I'm going 30 years backwards because this is such a new field, and we wanted to kind of include it into the clinic here as well, because a lot of women just don't know what to do when they have engorgement, when they have mastitis.
This was something I was so surprised about when I started working with, women's health, female, and with, is that my stomach is growling. I don't know if you can hear that. Sorry. Was the amount of shame that women felt breastfeeding, and like so many women, it was, that was something that was really reinforcing postpartum. They were feeling like a failure. Nobody talks about how hard breastfeeding can be, and like the weight of that on a woman whose hormones are changing so much. It's just like a theme that comes back all the time with women, and it's not something that was ever talked about. So that was something that I found surprising when I first started practicing, was how many people struggled with it and how hard mentally it was on so many women.
Absolutely. You know, we say, oh, breastfeeding is natural. Well, natural doesn't mean that we know how to do it. There's a learning curve, women, and from one baby to the next, there's a learning curve as well. So there's hardly any support. It's unfortunate. That's the other aspect of women's health that is not, like we were talking about pelvic floor, but breastfeeding is also so difficult to have the proper support. And I know I had 4 children and I had twins that I breastfed as well. And the support wasn't there. When I had mastitis, the first thing they did was to give me medication. That's not what the World Health Organization says. You're supposed to wait 48 hours, but to have the proper treatment instead of going to antibiotics. So we don't, unfortunately, have the support. We're not having the women know what they should be doing. We leave them on their own when, like you said, they're so vulnerable.
If a woman is experiencing acute mastitis or engorgement, what would you say to do?
So there has to be drainage happening, and everybody is doing drainage towards the nipple. It has to be drained towards the axillary, because that's where the lymph nodes are. We have to, a lot of people don't understand that clogged ducts are not within the duct, but it's because of swelling around it that squishes the duct and it can't have the milk go out. So even if you try to squish it out, you're just increasing the swelling.
Inflammation.
So you've got to massage towards the axilla and just doing hand expression. Hand expression is supposed to be taught to all women leaving the hospital. I'm not talking about pumping, because if you start pumping, you may increase the milk supply. So when there's mastitis or engorgement, it's just trying to do proper hand expression and the proper massage to be able to drain it. I know physiotherapists have done ultrasound. It doesn't work any more than maybe putting heat, but it works so well to do the proper draining. So this is what we do at the clinic too. There's 2 of us in physio that are trained to do this type, but we have to take them right away. And if they call the clinic, we're like, for us, that's an emergency, and we see them. We have a lactation consultant that has also taken this specific training, so she can do it too. So there's actually 3 of us now that can do it.
And for the therapist, and for my own curiosity, do you guys offer that course on your?
Yep, that's through my teaching company. So this is open to physiotherapists. It's open to lactation consultant. So it's not, I think, some massage therapists. It's not just to pelvic health physio. It's a little bit different. Pediatric physiotherapists do take that too, because a lot of
the mom is there.
Yeah, because a lot of babies having either the flat head syndrome, which is the plagiocephaly, or having a torticollis, will not feed properly, and if they don't latch on properly, then they cause some engorgement or mastitis to the mom, and it's a vicious cycle. So sometimes the baby has to be treated as well.
Yeah, I definitely see a lot of that.
Yeah,
it's always goes together.
Absolutely, it's a dyad, right? They have to work together, and that's often. I would say that I think the breastfeeding that's what's the most difficult, is to make the mom understand that it's
symbiosis.
the 2, right? It has to be together.
Absolutely.
Yeah.
It's interesting. I'm glad that subject was brought up, because I didn't realize like how archaic we still are in that realm.
I don't understand how we expect women to leave the hospital with a new baby Like you said, hormones are changing, are all over the place. We send them home with 24, maybe 36 hours, and they're in pains. Often, there's been some tears on their perineum, and they're tired, and then now they want to breastfeed the baby, but now this is getting to be a little bit overwhelming because they're tired. They don't have the support, and everybody has a different advice for them.
Yes.
Yeah, they can ask 10 people, they will have 10 different advice, and that's difficult.
I'm amazed too. The women that I have spoken to, they go into the hospital and it's either they went through major surgery, C-section, sometimes a traumatic birth, sometimes everything goes well, and I've heard some pretty horrific stories of them having to stay in the hospital for 4 days, being shamed that they can't get their milk supply up. And they're like, you're not leaving until you can feed your baby. And the baby's not gaining weight. And they're just not getting, like you said, not getting any very helpful support. And literally shame is put on them. Or women who, come out of surgery and it's just like, baby put on you and it's like, feed your baby. It's like you're, as the mom, like you just went through this incredible thing. Like you grew a baby inside of you and it came out of you. And now you need to keep this baby alive and you don't matter anymore. All the effort that you just went through, we're moving on. It's about baby. I find that I've never been through it, but I just find, I don't know how you can go from being the pregnant woman that everyone's opening doors for and, rest your feet, relax. And then the second baby comes, it's like everything that you did doesn't matter anymore.
Yeah, it's true. It's so true. And it should be, like I said before, everybody expects that, it's normal. You should know how to do that. It's not. It's really something that women have to learn. They have to, it's not that easy. And some women really struggle. They really struggle. And sometimes I feel that, like you said, the shame is so big that they have to breastfeed. And sometimes maybe it would be okay if they did a mixed feeding and don't put all this pressure on them, because the more stressed you are, the more tired you are, the less milk you have. And then it's a vicious cycle. This
is exactly the concept why I wanted to start this podcast, is because as much as I love the wellness world and health, I find there's a lot of shame-inducing aspects to it. Like if you don't do everything all natural and have your smoothie and do this and follow this weird image that there is out there that doesn't exist, it can become a shame-inducing thing. So this is why I want to have people on like you, where we can really talk about how these things are hard. They need to be learned. It's not just everything in the woman's body is natural and you need to instinctively know everything that you have to do. And there's so much health and wellness advice out there that women, are constantly feeling like they're failing. It's not even just about being a mom, a breastfeeder, your pelvic health. There's just so many layers now in the wellness world where it's, anyways.
The one that I really have a hard time with is all these women that are posting on Facebook or whatever on social media that they're back to activity after 2 weeks after having their baby and they're running and they're doing this. No, they shouldn't. You have to spend time with your baby. There is a certain amount of time that you're supposed to rest, and going back to doing CrossFit and doing jogging 2 weeks after is not good. They should not be doing that. So there's so much misinformation out there, or shame of saying I'm super mom, I'm doing it. And then of course the person that looks at that and is having such a hard time. She spent the whole day. It's 5:00 in the afternoon. She hasn't even gotten to take a shower yet because she's had to nurse the baby all day, and she's tired, and baby has cried, and she's looking at that post and she goes, my gosh, I'm so useless. But no, she's the one that's taking care of the baby, and she's the one that's doing it properly. But,
but rest is not we're in a performance driven society. So, and it's hard. And I know a lot of my friends who are very type A really struggled when it's like, I have to stay home and I can barely get through one load of laundry and I did nothing today. And it's like, no, like we need to rewrite that narrative to be like, this is what it's supposed to be like take care of yourself, or you're just building this new relationship. Like you just grew a human inside of you. And
exactly.
There should be something rewritten where we really highlight and honor relaxing and recovering. Because I agree. Yeah, there's so many people. It's like, oh no, my gynecologist cleared me at my 6th week. And it's like, did they do an internal exam? And did they evaluate your diastasis recti? Did they look at all the different muscles? It's like, no.
Did they look at organs?
And that's why. Did they look at organs?
Yeah, exactly.
So
because
there's so many layers.
That's right. And we're actually quite lucky here in Canada because the maternity leave is very is quite generous compared to other countries. I was on a webinar a couple of weeks ago, and it was called the 4th trimester around the world, and people were talking in their countries, and in the States they have about 2 to 4 weeks of maternity leave after. So they have to go back soon after. And other countries were like, oh my gosh, like the opportunity that you have in Canada. But then we started to compare, and what we're lacking is the support to the moms. We give them the opportunity to be able to be with their baby for a year, but we don't give them the support when they need, when they have problems or they have some issues after.
Okay. That's interesting. That would be a really interesting seminar.
It was very interesting to hear how it was around the world and what kind of programs that they had. Yeah.
Who would you say is the leading country in?
I would say Australia.
Who should we be modeling? Australia?
Yeah, Australia is quite good in terms of the programs they have, and
Okay, interesting. So just wanted to touch on one last subject before I let you go. So because this is going to be released during Endometriosis Awareness Month, I just wanted to touch on that a little bit. I did my osteo thesis, they call it a thesis, on endometriosis. And what I was so surprised about was how much research was actually out there. So I was so surprised because I just always assumed, like osteo treating, or even like treating organs, the adherences that can be created with endometriosis. I just always assumed, this was a very osteopathic technique with very little published research. And then I got out there because everyone that I was seeing with endometriosis, there was never mention of like, go to your pelvic floor physio or it was very go on the pill, and excision, hysterectomy were the best courses of treatment. And I assumed that was because that was the most scientifically backed. But then I found all of this research about the effectiveness of pelvic floor physio. And there's a specific couple, the Werns, who published so much research where it was literally women would be getting pregnant after the visceral manipulation and pelvic floor therapy sessions after being told that like their tubes were completely tied, and just from breaking up fascia and adherences. And I was just amazed. And I'm like, why isn't this information in the doctor's offices yet, where it's like systematically someone with endo, all of the pelvic health issues, but endo is something that's important to me. Why isn't all of this common knowledge, if it is published on PubMed, like up to date, all of these resources that the doctors have? So I was just wondering to get your take on endometriosis and what you thought about that.
So endo is such a big beast, right? Because there's so many different ways of looking at it. And it is also the type of thing that you can have a lot of endo clusters and have very little pain, or very little clusters and lots of pain. So I think that what has happened over the years is the doctors have realized that just doing excision, doing hysterectomy doesn't seem to treat all the problem. And doing, I think the best is having that osteophysio approach. Like I love to work in combination with osteos and be able to do some of the internal stuff, but it's mobility. Anything that lacks mobility will start to give pain. And I think that's anywhere in the body. So we don't realize that, like you said, when there's endometriosis around a certain structure, that starts to give pain. There's a lot of endometriosis that will go between here. If I put, so that's the uterus and the vagina and then the rectum. So when the two are in the body like this, there's a lot of endometriosis that comes to the back, like between the rectum and the uterus, right into this area right there, which is called the Douglas pouch. And going to treat that area where the ligaments of the uterus, these big ligaments here, are attaching. This is a crucial area to go and increase mobility. But it's also an area where there's a lot of fascia from the pelvic floor muscles, a lot of where the muscles attach. So these women might have problems like with their bowels. They will have pain. So in pelvic floor physio, it's about mobility, but just like in osteo as well. Osteo is about, mobility of structures. So we in Quebec, we are not working on the organs as physiotherapists. Outside of Quebec, they can work on the organs as physiotherapists, but not in Quebec.
Really?
Yep. Yeah. So visceral mobility is okay. Like my colleagues in the West or in the East, they can work on organs. But in Quebec, we are not specifically, like we can't. But we can work on ligaments. So this is what we're doing, because I'm not saying that I'm working on the uterus. I'm working like the mobility.
Uterine ligaments.
Of the uterine ligaments. So I can work on ligaments. I can work on fascia. And it's increasing the mobility. If you have a rectum and a back of the uterus that are being held together without being able to move, well, there's going to be pain with intercourse. There's going to be pain when the stool comes in and moves opens up the rectum. Ouch. So all of that will cause more pain. And then, of course, the uterus changes depending on the time of the month. If they're not on any medication, then they're going to feel that more. So in physio, there's like the other thing too that happens is what do we do when we're in pain? We're like, oh, I have pain. So you tighten up, right? If I have a headache, what do? We go like, oh, I have a headache. But it's just making it worse because I'm tightening. So a lot of people do that with their pelvic floor. They'll tighten up everything just because there's pain in the area. So getting them to learn breathing exercises. So this is also big because, as you know, the diaphragm works with the pelvic floor. So when you breathe in, your diaphragm goes down, your pelvic floor should go down. When you breathe out, your diaphragm goes up and your pelvic floor goes up. But let's say my pelvic floor is really tight. So I'm breathing, but there's nothing going down over here. So I'm squishing the organs. And I breathe how many times a day? So then it's sort of not allowing for the organs to have that up and down movement, which is not big, but it doesn't matter. Like think when you have a little rock in your shoe, you think, oh my gosh, this rock must be huge. You open your shoe, you find the rock, and it's this tiny little thing. So it's the same thing. If there's a lack of mobility, just even with breathing can cause them pain. So it's mobility of the area. So we're not treating the endometriosis because we can't get rid of the clusters.
The lesions,
we can definitely help with mobility, help with the whole abdominal cavity. And there's a lot of pain education to do as well. This whole neurophysiology about pain education helps because it comes back to what I was saying at the beginning. We can have a lot of endometriosis and not have too much pain, where we can have very little endometriosis and have a lot of pain. So there are ways of managing that too through the like the brain loops and getting that. So it's like looking at it in a pelvic pain way.
Would you have maybe 3 tips or at-home things that, isn't specific to a certain person or that anyone with endometriosis could maybe benefit from?
So the first thing would be breathing exercises. Absolutely, to start and even take a little app like Respi Relax or those balls going up and down on YouTube of breathing in and breathing out and starting to do some of that. The other thing is just doing some, I would say yoga, but it can't be power yoga. It can't be like hot yoga. It has to be
restorative or yin.
Exactly, because with some stretching will be good. And one of the things is that helps a lot is the visualization. Visualizing that the area is okay, because as soon as the brain thinks that there's something wrong, it increases the worry. And the more worried your brain is, the worse it is. So it gives more pain because it's worried. So calming the brain down with the breathing exercises, with doing some mindfulness and the yoga. I think those are things that, like stretching in the area, gentle stretching. But this is definitely, because you can have yoga that will increase tightness of the pelvic floor, but you can have yoga that will help to relax the pelvic floor. So like child's pose, the happy baby pose, those are all poses that will help to relax the pelvic floor. So I would go for that kind of pose to be able to relax the pelvic floor and get that, because it is about relaxation of the pelvic floor when there's endometriosis.
Okay. Wonderful. Well, I think I'm going to end there. I think that was extremely useful, and I'm definitely going to suggest all of those things in my clinic as well. So I really want to thank you for... I know. I'm like, can I just keep you here all day?
Yeah.
But I'm sure that you're busy. But yes, I'll have you on again for sure. We can pick a specific topic one day. But thank you so much for giving me your time. I mean, I felt like I had an idea of how much that you've done, but you've done so much more that you've exceeded my expectations. And I feel very grateful that you took time out of your day to speak to me.
Oh, well, thank you. Thank you for having me. That was great. I wish you all the best with this podcast.
Oh, thank you. Just one other thing. So for people who maybe want to book an appointment with pelvic floor physio, what's the name of your clinic? How can people get an appointment or reach you or your clinic?
So here we're on the West Island of Montreal, and it's called Kinetex, Centre de Santé Pelvienne. If people go on the website, there is also, we do offer a 20-minute call. They end up for free, so they can call, they can make an appointment and talk to a physio if they have any questions. So that's something, like some people like doing that before booking an appointment, just to see, okay, do I need it? Do I not need it? So we're in Pointe Claire on the West Island of Montreal.
Perfect. All right. Well, thank you so much.
All right. Thank you.
Okay. Have a wonderful day.
Thanks. Bye.
Bye.